Question ideas for the coming New Zealand COVID-19 inquiry. Will the upcoming New Zealand COVID-19 inquiry provide meaningful examination of this appalling peacetime catastrophe? There were, and still are, many physically and emotionally damaged people affected by this catastrophe, including sadly, those who also passed away. Just brushing these issues aside, or failing to even talk about such issues, or worse still, blatantly lying that New Zealand had one of the best post-COVID mortality results in the world, or even far worse still, that nobody was forced to vaccinate, everybody had a choice, offends and insults nearly every single Kiwi. People lost their homes, their livelihoods, their loved ones, their happiness. And many people are still suffering today because of the way the Ardern-Hipkins government handled the COVID-19 pandemic. Ardern and Hipkins found the time to speak daily from the pulpit when there was only one death, but when the borders were opened and COVID deaths started to soar, their silence was deafening. Post-COVID excess deaths hit the world stage, but our brave open and transparent so-called leaders exited stage left, without a word to anyone, not a single peep. Why so shy? By not even acknowledging the issue, or even attempting to reassure people that all was not as bad as it looked, made the issue of excess deaths a lot more serious, and created a scenario that could only be described as a cover-up by high-ranking politicians and academics, that I believe still holds true today, and heads should roll. In this regard, the irresponsible silence of the left-bent, bribed and corrupt woke mainstream New Zealand media, effectively betrayed and backstabbed every single New Zealander. What a failure of journalism. But how will the inquiry address these issues? Will it simply reinforce the mainstream media and government messaging, or will it provide a meaningful and thorough examination of this peacetime catastrophe? Given the current narrative regarding one of the most controversial of pandemic measures, the use of lockdowns, one might perhaps be allowed a little skepticism. This inquiry should also seek to understand how and why the world's political and scientific establishment cohered around a completely untried and untested model for dealing with the COVID outbreak. The inquiry should seek to interrogate how and why the draconian lockdown approach became unchallengeable, leading to a situation in which 40% of the deaths from COVID-19 in the Western world took place in the most vulnerable of all settings, care homes. Did lockdowns produce the crisis we now see flooding the health service? Should more care have been focused on the vulnerable, while allowing the rest of society to continue as normal? Would this have then mitigated the damaging effects of lockdown on young people and societal mental health, as well as avoiding the immensely regressive consequences of school closures? Although the effects of lockdown should lie at the heart of the inquiry, there are other aspects of the pandemic which deserve scrutiny. Why, for example, did the New Zealand government ignore the potential benefits of natural immunity, when evidence suggested early on that prior infection confers durable protective immunity? The idea of letting the virus spread through people who are at low risk from it, namely the overwhelming majority of the population, thus allowing those people to generate antibodies, while protecting high-risk groups, was a well-established epidemiological concept, and yet it was dismissed. Why? There are many issues that need to be addressed and answered at the New Zealand COVID-19 inquiry. Good luck, great Kiwi team of 5 million. Thank you for listening. Geraint, on behalf of WhangareiTim.